they need a lot before there's any help at all. Sometimes then a dad's hand may prove helpful. There may be other ways of testing things, but it's very complicated and it's an uncertainty in the early stages. So we just take everyone as an individual and we try to figure out the testing. There are some findings on the MRI scans of the brain that indicate one more than the other. It's very complicated. I better leave it at that. But anyway, it does look like Parkinson's, but we don't think it's in the same bucket. And so it takes a specialist to really work through it, and it takes time.
Dr. Sire, Amantadine, can you explain what kind of a medication it is and what it is used for?
So Amantadine is an interesting medication because we kind of call it a dirty drug because it has a lot of different effects on different receptors. And so it's used in many different ways. Prior to having carbidopa-levodopa, it was kind of one of the only drugs, or in a list of some of the drugs that we use to treat Parkinson's disease. So much these days we don't use it for the majority of symptoms because we have Sinemet for that. But we do use Amantadine to treat sometimes the dyskinesias or the kind of the abnormal movements that can happen because of the levodopa. That's a very common use of that medication. Amantadine can also be helpful for dystonia as well, and sometimes for tremor. Amantadine also has a notorious side effect of worsening hallucinations. So if someone has hallucinations, it's a medication we avoid. Or if they start to develop hallucinations, it's one of the first medications that we start to taper down on and take off. So it's not without its risks.
Dr. Body, how do we treat dry mouth?
Drinking water. Dry mouth in Parkinson's is uncommon. The most common problem in Parkinson's is drooling, too much saliva in the mouth. I wonder that in majority of the cases, dry mouth is a medication side effect. I have seen some patients complain of dry mouth while they were having drooling. It may be that they drool so much that the mouth actually is dry and the saliva is just running out. But I think the bottom line will be to make sure that it's not a medication side effect because it's not a common disease-related process. We rule out other causes, vitamin deficiencies, other concomitant diseases. I find many patients with rheumatological disorders that commonly have dry mouth, in Parkinson's patient, and so on and so forth. So it's not a common part of Parkinson's disease in itself. So it's very important to rule out other causes, especially medications.
Dr. Torres, can a traumatic event cause PD?
My guess is that the question is can traumatic brain injury cause PD? If you injured your brain, you could develop signs and symptoms that look like Parkinson's disease. There are strokes that have been shown to produce similar symptoms than Parkinson's disease. But it's not Parkinson's disease, it's not a degenerative condition, it's actually due to the injury that the stroke caused. You also can have medications that produce all the signs and symptoms of Parkinson's disease, for example, antipsychotics, and the presentation of the patient is indistinguishable from regular Parkinson's disease. So this is why it's so important that you have a comprehensive evaluation at a subspecialty clinic so that they can actually tell, what is it that you're dealing with. The short answer is that traumatic brain injury has not been linked to Parkinson's disease, what we call Parkinson's disease. It can cause Parkinsonism, meaning the signs and symptoms of Parkinson's, but is not the same condition.
If I could extend that question a little bit, Diego, do you think Muhammad Ali had Parkinson's disease, or do you think there was a thought that because he was not always floating like a butterfly but singing like a bee, there were times when he was taking punishment.
Right.
He didn't so much at the early. What do you think about that?
Right. So there is a condition called dementia pugilistica, which is one of the many conditions that are caused by traumatic brain injury. And Muhammad Ali had a lot of head injuries, right? He was evaluated by some of the top minds in Parkinson's disease in the world. And because of the way his condition progressed and occurred, it was very clear that he had idiopathic Parkinson's disease, the regular Parkinson's disease. And in the opinion of the treating physicians, this was not due to any head injury. So as you can see, you can get a lot of hits to your head, and that doesn't mean that you're going to develop Parkinson's. At the same time, there are patients that we have that have had brain injuries, and they present with Parkinsonism. So both can occur, but in this particular case, he seemed to have the regular Parkinson's.
Dr. Torres, deep brain stimulation is being done in Israel with powerful ultrasound. Is this being done in the US, and is any research being done?
My guess is that the question relates to brain surgeries done for Parkinson's disease using strong ultrasound waves rather than ultrasound waves being used to do deep brain stimulation. So currently in the United States, there are systems that use very strong ultrasound fields, and these ultrasound fields can damage a particular part of the brain, and by damaging that particular part of the brain, the patients can get better. This is what we call injury surgeries or lesional surgeries. And they have been around for more than 60 years. We used to use them all the time. The difference between the injury-based surgeries, which can be done with ultrasound or it can be done with heat, injuring a particular part of the brain. So the difference between these injury-based surgeries and deep brain stimulation is that deep brain stimulation is completely reversible. So as you are giving stimulation to a particular part of the brain, if that stimulation is giving side effects, you can turn it off. In fact, not only the doctor can turn it off, the patients themselves can turn themselves off if they need to. So that's the difference between, lesional surgery and deep brain stimulation surgery. When you get lesional surgeries, you can have great benefit. The possibility of having residual neurological problems out of the injury are higher currently than if you underwent deep brain stimulation surgery. And there are many reasons for that. But the field is evolving, and of course what we want is to be the least aggressive we can be to help our patients. So stay tuned, but I don't think that we have reached the point of a prime time for ultrasound-based surgery quite yet.
Dr. Body, many PD symptoms seem to be controlled by different areas of the brain. Is this caused by the spread of Lewy bodies or by lack of neurotransmitters?
So it is correct that there are effects in many parts of the brain that results in symptoms of Parkinson's, not just the substantia nigra or dopamine. It's also correct that there is loss of neurotransmitters. Most changes in the neurotransmitters are due to damage to the cells. So Lewy bodies potentially spreading and affecting other areas of the brain or other reasons for loss of brain cells in Parkinson's. There is some changes in the neurotransmitter sensitivity in Parkinson's brain without a direct loss of change in sensitivity of receptors in this part of the brain. But in the end, it all stems from the damage or loss of brain cells directly or indirectly, which leads to alteration in neurotransmitter levels and sensitivity to neurotransmitters, which in many different parts of the brain, which leads to various different symptoms in Parkinson's.
Dr. Sire, how do the medications used for overactive bladder interact with PD medications?
So bladder medications are commonly used in our patients because urinary symptoms are quite common, but they can have some side effects. So one that Dr. Merman was alluding to earlier this morning was that they can act on the CNS, and they actually do, some of them do the opposite effect of what we're doing when we're treating with a medication like donepezil or Aricept. So when we're treating with that medication, we're trying to boost up a neurotransmitter called acetylcholine. And some of the bladder medications actually block that medication. So not uncommonly, we find patients on both medications, which doesn't make a whole lot of sense if we're trying to boost up those levels with one drug, and then at the same time, another drug is trying to block them. Additionally, some of the bladder medications can also affect the blood pressure as well, and so they can lower the blood pressure and cause that orthostatic hypotension. So they do definitely have interactions with other medications that we're using and effects on Parkinson's.
All right, one last question. Dr. Bertoni, have there been any epidemiological studies done in Nebraska that you're aware of?
Yes, we've done epidemiological studies in Nebraska looking at the environmental contaminants in the water as one marker. There have been people that have found some sort of heavy metals in the soils of some area that seems to be connected to a rise in the amount of Parkinson's disease, but we need to do much, much more. We are doing more in general. There is a lot being done, but there's a lot more that needs to be done. For example, in China, it appears sometimes it's more in the cities than in the rural areas. And in our country, it seems to be the opposite. So the answer is yes, we have done studies, and there are more that need to be done, but we don't have all the answers. So we'll leave it at that.
You had said it was the last question, Julie.
Yeah,
so.
I saw that one, though there were several that related to that. So
Okay,
I'm sorry.
so I guess, is this the last question?
This is the last
Let's
question.
hold her accountable. Okay. Everybody wants to go? Last question says that I mentioned camptocormia, which is that abnormal posture forward. And I said that it can be ameliorated by botulinum toxin. When we asked our physician about that a few years ago, we were told that the site is impossible to inject, which is correct. So the pictures that I showed are pictures that were published by experts from Baylor College in Texas, Dr. Joseph Jankovic, who is an internationally renowned expert in Parkinson's disease and in dystonia and in toxins. So the answer to that is that you want to be evaluated by experts who understand how these toxins are used so that you can get some benefit. So on the very few, very small case series of this particular condition, about 30 to 50% of patients had benefit from the injection. So what that means is that it's not 100%, but maybe half of the patients will see some benefit. We do them all the time in our clinic, and about half of the patients get benefit and the other half don't. Thankfully, camptocormia is not a common condition, and therefore is not seen everywhere, and that might be the reason why some physicians might not know how to fix it.
You guys, I would really like a round of applause for this amazing group from UNMC Nebraska Medicine Department of Neurological Sciences. And yes, work is this enjoyable every day, I promise you. I promise you it is. Thanks, guys. Thank you. All right, we're just going to finish up with a couple of things. Remember your evaluations that are in the back of your programs. Please fill those out. If anybody wants pictures, you're more than welcome to do that as well. Remember, the booklets are all on the website as far as any of the PowerPoint presentations that you want. I also want to take a minute to thank Sally Weathers. She is our event coordinator. She's been on the job about 5 months when they threw her into this with me, and she has done an amazing job and has been so easy to work with. And also thank you so much to the administrative staff who all came out today to help get people checked in and make sure that everything went smoothly. So you guys, thank you so much for coming. This truly was an amazing day. Thank you.